Greetings, everybody, and thank you for joining the Lurie Children's Community Provider Symposium. My name is Jhaveri, and I will be your moderator for this afternoon. I am the physician liaison for the North and Northwest suburbs and the city north. And today, I'm very excited that you're all joining us because we are introducing our new Director of Physician Services, Amy Lotti, and Lena Belmonte has been promoted to the new manager of Community Connect. So we'll be introducing her to you. And then we are going to have a presentation from Dr. Ravi Jhaveri, our division head for special infectious disease. He'll be talking about the latest updates for COVID, flu, RSV, and what to expect for this upcoming season. Then we're going to have a presentation from Dr. Ravi Patel. He's our Vice President for Digital Health, and he'll be talking about Care Connect and the MyChart appointment scheduling that I know many of you are very excited about and have been using. And then Julie, Paul, and I will be talking about the new programs, services, and outpatient centers here at Lurie Children's. And then lastly, we'll be not introducing live, but we'll be telling you about our new Lurie Children's specialist. So before we get to Dr. Jhaveri, I want to introduce our team to you. And as I mentioned, Amy Lotti is our new director. Amy, can you say hi and say a few words about yourself?
Sure, thanks, Chad. Hello, everyone. Everybody's having a nice day. So my name is Amy Lotti. And while I'm new to the physician services team, I've actually been at Lurie for many, many years. I'm a licensed clinical social worker by background, did clinical work for many years in the community and then here at Lurie, and have been in a leadership position primarily in the psychiatry and behavioral health department before moving to physician services. So I'm really excited to be here and very happy that everybody is able to join us this afternoon.
Thank you, Amy. And then we have Paula Nowak. She is our manager of physician services. She's the liaison for the city, the near west and south regions. We have Julie Kalkbrenner. She's our physician liaison for the west and northwest suburban region. And of course, me, north and northwest suburban region. And then, as I mentioned, we have Lena Belmonte. She's our new manager of Community Connect and Relations. Lena, are you on the line? Lena, I just unmuted you. You should be able to say hi to yourself. Why don't you tell a little bit about your new role to everybody?
Yeah, thank you. Can you hear me now?
We hear you great.
Okay, great. Thanks, Chad. Hi, everyone. For those of you that don't know me, I'm Lena Belmonte. I've been with Physician Services for about 7.5 years now. I was previously in the role supporting Epic Care Link and enrolling our practices and supporting them through the training on joining our Epic Care Link Epic instance. I've moved into the manager of Community Connect Relations role about 6 months ago. So I'm supporting our Community Connect practices again, as I did previously in our coordinator role. So you might have known me then, and also continuing to support our Epic Care Link users as well. So thanks for having me today. Thanks, Chad.
Thanks, Lena. I'm sure everybody is looking forward to working with you. And if you have any questions for Lena about any of that information, feel free to email her at lbelmonte@luriechildrens.org. So before we move on to Dr. Jhaveri, I just want to remind everybody to bookmark luriechildrens.org/physician services. This webpage, as most of you know, provides you with really important referral information. All that great information that you need for referrals is right there now at the touch of your fingertips. All you do is click on any resource that you need, and that is everything between outpatient center schedules and specialist schedules to lab requisitions to phone numbers and services by location. So I highly encourage all of you to use this webpage. It is, like I said, everything is right there at your fingertips. And if any of you really need a tutorial for it, one of your liaisons is happy to do it for you. And then lastly, just a reminder of Lurie MD is here for you This is exclusively for physician to physician call line, and it's 1-855 MD or 1-855-587-4363. And once again, if you need a new tutorial on Lurie MD, please reach out to your liaison or send us an email and we'll be happy to do so. So I'd like to introduce Dr. Ravi Jhaveri. He's our division head for pediatric infectious disease. And he's going to be going over what to expect this season for COVID, flu, RSV. But I'd like to encourage you to please ask questions, whether it's raising your hand to talk after his discussion or while he's talking and something comes up. Please go ahead and answer something, ask him in the chat room, and we will go ahead and ask those questions for you. Dr. Jhaveri, why don't you go ahead and take over?
All right. Thanks, Chad, and thanks to all of you for being here and for having me today. So I'm going to look in this very cloudy crystal ball and offer you some predictions about, or thoughts, actually, not predictions, but some thoughts about the upcoming respiratory virus season, ongoing COVID, as well as flu and RSV. These are a couple of my disclosures. I do consult for some companies related to flu vaccines, but none of my other disclosures are relevant to this talk. So we're going to talk a little bit about the upcoming flu season, some new information, and again, maybe a prediction, review a little bit about RSV circulation, and then a brief discussion about Omicron boosters and COVID-19 vaccines. All right, so you can go to the next slide. So just wanted to review the versions. I think obviously everyone is most familiar with this part of the slide, which is the traditional egg-based inactivated influenza vaccines, of which we have many options, pre-filled syringes.
Sorry.
And then the, go ahead to the next slide. And then the just a review of some of the other options that are now available for kids. The cell-based vaccine is now approved for use down to 6 months in the pre-filled syringes as well as in the multi-dose vials. And just reminding everyone that the multi-dose vials are the only ones that have the thimerosal preservative. The single pre-filled syringes have no thimerosal in them. And then the live attenuated intranasal vaccine in the intranasal sprayer, that also does not have thimerosal. I actually just heard the other day from the company that there may be a delay in delivery of the live attenuated vaccine. So for your practices who have ordered it, you may not see it until November. So it's just important to think and prepare as you go forward. All right, so here's where I predict a little bit on, go ahead. So, you know, when COVID-19 pandemic started, especially the first winter season after the onset, I think the buzzword in the news was the twindemic. And we've feared that at some point we were going to be hit with the combination of COVID-19 as well as a full-on seasonal influenza season. You know, we all know that the last 2 seasons really that hasn't happened, that we really have seen very little in the way of influenza activity. The first season we saw next to none. And then the second season, last winter, we had sort of blips of activity, but nothing close to a full historic season, okay? And people have talked about, sorry, I just want to make the last point there. So people speculated as to why that was happening. Was there some degree of viral interference? Was SARS-CoV-2 really crowding out everybody else? Was it because we were just wearing masks and keeping our distance, or was it some combination of both? And it's probably the latter, but we'll never know for sure. Next slide. So this is just a paper that describes viral interference, and the fact that this is not a new phenomenon. We've known that respiratory viruses do interact with each other, and so the paper on the left actually has done some modeling using many seasons of data, looking at the influence of one virus against another, positive or negative. And really the highlights about influenza A and B versus human metapneumovirus or parainfluenza or the like. The second paper on the right just showed the disturbance of respiratory syncytial virus circulation after the 2009 H1N1 pandemic. And just the idea that it took about 2 years for the seasonal circulation to kind of adjust back to the prior pattern. And so this is not unprecedented by any means. Viral interference is around and definitely a thing. Go ahead. All right, so one of the ways that we can kind of make predictions is to look at what is happening in the Southern Hemisphere. Most often, we look to places like Australia to see what has been circulating. And what we've seen this particular year is what looks like a resumption of a robust season of influenza. You will see this is a fairly recent slide from the Australian surveillance, flu surveillance group. And the red line is this past flu season. And you will see that compared to all of the others, this is influenza-like illness. So the challenge with influenza-like illness is that it is not specific for influenza. And so you'll see like that 2020 peak obviously was all SARS-CoV-2 cases in March and April going into the spring. And so, but compared to the prior seasons, let's say 2017, 2018, 2019, all pre-pandemic, this past season was more active in terms of the number of influenza-like illnesses that they saw. Next slide. Then when we look at lab-confirmed flu cases, again, that supports the idea that this was a more active season than what they've seen in the last 5 years, with a very robust number of detections. I would just say, some people might say, oh, but we're testing everybody because of COVID, but that's actually not true. We've been testing everyone pretty actively ever since 2009 after the H1N1 pandemic. And so this is not strictly a testing phenomenon. Next slide. And then looking at the breakdown of what these isolates are, the public health labs will first do an A versus B, and then they can do a subtyping of H3 versus H1 versus something else if that happens to be circulating. But usually that's the breakdown. And what we see in Australia is that these are almost all type A's, and that the ones that are typed are almost all H3N2. And there's very little H1N1 that we're seeing, and they really haven't seen much in the way of flu B activity. All right, so going out on a limb, I'm going to say, and I think many others have said this, so we are going to have a more normal or usual flu season this year. We expect that it's going to be an H3N2 year. And what I think maybe all of you have this sense is that it seems that fewer people are really seeking vaccine compared to pre-pandemic. I don't know if that's vaccine hangover or hesitancy or fatigue or what have you, or just that our systems have changed in the pandemic and maybe we need to resume some of the sort of flu vaccine outreach that we used to do in the past. Next slide. All right, so what about RSV? Next slide. So this is pulled from CDC detections, and what we have seen is certainly that, and I know that many of you are already aware of this, that both the percent of positivity on detections has shifted. So our RSV season is certainly outside the norm after the onset of COVID-19 in 2020. We saw that RSV was really pushed into the spring of 2021. And then we've seen sort of a little more like usual activity, although it's been sort of steady RSV. And so the AAP still has the sort of blanket, like anyone who's high risk should get RSV prophylaxis without sort of regard to season. I think we will see more of a peak, and you're starting to see it a little bit on the far right side of both of these graphs, a peak that is starting to increase, and the trend level that they have is starting to increase as we approach the colder months of the year. Next slide. All right, so then just briefly, COVID Omicron boosters. So the boosters are here, and so many of you might be saying, now what? Just to review and level set, the FDA did approve this new version of the vaccines from each manufacturer. It contains mRNAs from the original SARS-CoV-2 isolate called the Wuhan isolate, and then also the mRNAs from the currently circulating BA4 and BA5 isolates, okay? And these can be used now for both primary series and booster doses for older children and adults. There's been a lot of hubbub about the fact that these were not approved in the same way that many past vaccines have been. And I think while that's technically true, I don't know that that's really the big deal that people want to make it out to be. They extrapolated this approval from a couple of different sources. The prior versions of Omicron vaccines with the sort of first or second really Omicron isolate, the BA1, there was a vaccine that was studied in humans, and so there was good immunogenicity data from cohorts used vaccinated with that version. And then to take it a step further, because they wanted to make sure they were skating to where the puck is now, or where it would be, there was animal immunogenicity data with the BA4 and 5 version of the vaccine. And so given the fact that we have vaccinated hundreds of millions of people with this dose, this is, with this version of the vaccine, this is a little bit like the process we might take for flu, where we've used a process that has worked many times in the past. And we have a new isolate or new isolates that are included in a vaccine. We don't systematically redo all of our human studies with every seasonal flu vaccine. We rely on our historical experience and the process that I've had, and then we make an approval and produce the vaccine based on that. What we've seen is that with the Omicron boosters that are out there, we're seeing a modest spike in the number of people seeking vaccination. This happens every time a new booster recommendation or new indication is sort of offered, age group recommendation, I should say. And so I think you'll find that, and all of you probably appreciate this, is a bit like the preaching to the choir phenomenon, where the people who are already intending to get vaccinated are really waiting for this new availability. And so they're the ones that are seeking vaccination. And so, so we will continue to see the blip corresponds to a few 100,000 people per day seeking vaccination with these Omicron boosters. Next slide. I know that many of you know this, but I think looking at the data is, to me, always still just cause for pause. We are not doing well reaching kids. When you look at the youngest kids, age 6 months to 4 years, only about 10 to 20%, not even 20%, but 10 or in the neighborhood of 10% have been vaccinated at all. There is certainly intent, but there's pretty significant intent not to get vaccinated. We've done okay with the next youngest cohort, the kids 5 to 11, not quite 50%, in the 30 to 40% range. And we did best really with the teens who were vaccinated earliest, maybe when there was the least amount of fatigue with the adult doses, and really pushing them out. And so I think we really need to reinvigorate this. Why does this matter? I know you guys all know this, but I think there's still the perception that all COVID in young kids is mild. I can tell you from the patients we see in the hospital, there aren't many, but we've had young kids that have had persistent and or severe disease. Some who are previously healthy, some who have underlying conditions. So we all know this. I know you can also appreciate, I have team members every week on my team that are out with COVID. test positive, need to stay away, have a young kid who got sick, whether it was at school or at daycare. And so even though people aren't dying, and we're thankful for that, COVID is still out there and still sort of a constant drag on life, economic activity, work, family, what have you. And so it's still not a trivial thing. And it's as much as I would love it to be, it's not over yet. We still have work to do. Next slide. So that's really my content. I hope I didn't go too far over, and I hope I left enough time for a few questions.
Let me go ahead and get to the questions that I see already asked. So first one, safety of COVID vaccine for the ages 6 months to 2 years and gotta help me with that one. Immunogenicity.
Immunogenicity
Yeah,
of the vaccine.
of the vaccine in the age group. Yep.
So the original vaccine version was studied extensively in young kids. And so there were no shortcuts. I want to make clear, there were no shortcuts in that. And actually the studies were done and redone, or doubled in size actually, based on FDA requests when there were some initial concerns about the myocardial inflammation that happened in the teens. And so I have no concerns about that. I would communicate that and really emphasize to your patients when you're talking to them. There were no shortcuts taken with the studies in young kids, and it is proven to be as safe and effective as the vaccine is in every other age group. And the dose was modified, so it's about 1/3 of the adult dose.
Great, thank you for that.
Sure.
Then next we have, within the last 24 hours, the CDC made a quiet announcement about masks no longer being required in medical facilities and nursing homes. Thoughts on that one?
I guess I'm not surprised. I think that it was probably coming. To be honest with you, haven't seen that yet. I guess it was really quiet. But I imagine that word will trickle out. I think that the adjustment will be slow. I actually was one of the people that thought that we might have masks forever, given sort of the background activity and the fact that the masks are incredibly effective at preventing transmission, not just of SARS-CoV-2, but pretty much all the other respiratory viruses we deal with. But again, I'm not surprised. I think there is this feeling that we really need to get back to whatever people are calling normal. And I think probably it's still going to end up being mask as a choice. And I wouldn't be surprised if many people will continue to wear masks in the setting, regardless of that guidance. I'm not going to advise people either way. I think they should do what makes them comfortable. I will admit that for me, it may take me a while to remove my mask.
Okay, thank you. Next is, what is the flu dose for kids under ages 3 years without preservative? CDC says can give 0.25 or 0.5. What do you recommend?
I think it will really depend on what you have. I think for the youngest kids, I think that 0.25 is fine. The sort of lower school age kids probably could get either or, and I think it's fine. I think there's for kids maybe who are getting the first dose ever in their lifetime, since there's what appears to be a lot of research showing that first flu isolate that you see really sort of becomes a template for your future immunity. I might err on the side of a higher dose if you're caught in the middle, but that's not based on a wealth of science. That's just my 2 cents.
Okay. The bivalent is now recommended for primary series. That was with a question mark.
For Omicron, you're saying?
I'm assuming it was typed in.
Yeah,
that, yeah.
I'm assuming it was the SARS-CoV-2. So I think that's more a pragmatic recommendation, that because they wanted to avoid confusion with people getting the prior version versus the new version and what could be boosted and what. It's already fairly complicated enough. And so again, given the wealth of data that's out there and the fact that the parent stain is still in that vaccine, that the new version will be used for everything.
Okay. A few more questions we'll try to pound through here. Any thoughts on increased illness, colds, et cetera, after kids have had COVID?
Subsequent, you're saying?
Okay.
I'm assuming that's what it is. I think,
Yeah,
you know, we know that this virus is incredibly inflammatory. I have not seen convincing data that that there is an increase in symptoms. There's actually been some discussion about, because of the incredible interferon response, that the virus suggests that there might be a window period where you're actually less likely to be infected. Again, I haven't seen convincing data either way, and so I don't know that I would make a recommendation to be, you know, more cautious or less cautious. I think you should be as cautious as you think is appropriate.
okay. I believe your site said that bivalent booster can be used in the primary series. Can you clarify? I thought the primary series had to be completed first.
Yeah, so the primary series does have to be completed. But what I'm saying is, let's say you encounter a patient. We're not talking about the youngest kids yet, because the Omicron boosters are not yet approved for the youngest kids. That is likely coming in the next few months. So, but let's say you've got a teenager or adult that has never seen the COVID-19 vaccine. You can start the series with the Omicron containing version and carry on.
Okay. In your opinion, should the primary care pediatricians be offering the COVID vaccine in their offices?
Yes, I strongly believe that is, I think we need to leverage any and all opportunities. And I think, again, most patients still are used to getting vaccines in their primary pediatricians' offices. And so I think that we need to really leverage our strength as a group in terms of being a trusted source of information and of vaccines. And I think that I think this is one of the reasons why we have such low uptake of the COVID-19 vaccines, is we haven't done it in the same way. I think in the beginning, we relied on these mass vaccine sites and pharmacies, and we haven't yet really fully endorsed and switched into this being part of the routine vaccination process.
Okay, so we're going to just take one more question here because we're running short on time. Any other questions that are on here? I'll make sure I send them to Dr. Jhaveri to get answered, and I'll send them back to you. If you are an anonymous attendee, please put in your name so I could send it to you. Otherwise, I'm not going to be able to get it back to you. Last one, when do you recommend people get boosted after COVID infection?
I always, to be honest with you, have to go back and look at the guidance to make sure that I've got it, but we tend to err on the side of you know, a couple of weeks after the infection. So I would honestly refer people to the most updated version of CDC guidance about when to seek vaccination.
Okay. And then one more, actually, Dr. Rakobo raised his hand. Dr. Rakobo, I'm going to allow you to talk, and if you go ahead and talk to Dr. Jhaveri if you like. You're all set.
Sorry, that was a mistake.
Oh, it was. Okay, well, we'd like to hear your voice anyway.
Thanks.
All right. Dr. Jhaveri, thank you so much for joining us today. We are gonna, like I said, there's some other questions in the chat room. I'm gonna go ahead and share those with you after our session, and then we will post them for anybody who needs them.
Sure.
So thank you so much. Okay.
Thanks,
so,
everybody. Take care.
Yeah, take care. As we continue on with our symposium here, I'd like to first say thank you so much for everybody who has been asking questions on here. It's very vital to the symposium to keep these things going. So thank you so much. But the next part of our symposium is we're going to go ahead and talk about our MyChart appointment scheduling with Dr. Ravi Patel. And Dr. Patel, are you available to unmute and go ahead and talk?
Yep. Can you guys hear me?
All right. Yeah, well, go ahead, and I'll just go ahead and move the screens for you, okay?
Awesome. Thanks. Oh, do you mind just pulling up my original slides?
I'm sorry. Yeah, I thought that's what this was. It must have.
I think they got distorted.
They must have got distorted. Let me share a new, folks, bear with me, please, as you get to see my,
I can share my screen as well if you want me to. Jeff.
Yeah, why don't you go ahead and share your screen? So it's
Okay.
I'll stop sharing mine, and you should be good to go. Thank you.
Mhm. So just wanted to do a quick digital health update. Chad had asked us to give you kind of the state of the land of where we are from digital health perspective. We talked about this, let's say about a year ago, and then about a year prior to that in terms of MyChart scheduling. We are now fully live in all of our divisions and Lurie Children's specialties for online scheduling. So for any of your patients that do need referrals to Lurie Children's, you can actually just have them log into MyChart, and we'll talk a little bit about how to create a MyChart account in a second. That has also gotten easier, but they can log into MyChart and then click on schedule an appointment. And those are all the specialties that you see on the right-hand side that are available for online scheduling. There's a very small handful of divisions that are not and will not be available for online scheduling, at least new patient scheduling. So genetics and developmental behavioral pediatrics are the two that really come to mind, and psychiatry. So those are the three areas where we will not have new patient scheduling through MyChart, but they will proceed with return patient scheduling. So for any of those patients that have been evaluated in those specialties, they will also be able to schedule online. For any of you who have not used it, actually on our MyChart homepage, there's a small video that shows you how easy it is to schedule an appointment. It's like 50 seconds long. That's about how long it takes to schedule an appointment. So it makes this whole referral process a lot easier, especially for your most common referrals as you think about patients that need to be seen. Anything that's a little bit more urgent, you may not see the right availability. You may still need to reach out to the division if you need to get them seen more urgently. Open scheduling is also live. This is our ability to schedule without a MyChart account. This is limited to immediate care, COVID testing, and COVID vaccination. And so you'll see here the screenshots on the left-hand side. So they're on the home page. They can click on make an appointment. On the left-hand side, they can then choose from this box. And here I chose immediate care. You'll see you get taken to a form, answer a few questions, and then you actually just pick a date and time. At no point during this process did I log in. It makes it a lot easier for a patient to be able to at least schedule an appointment and then identify a date and time that they can be seen either in our in-person centers, or I will bring you to our next topic, virtual immediate care. So we did a pilot with virtual immediate care for about 3 months earlier this calendar year from January through March. And then we decided to proceed with a more robust kind of consistent offering starting in July. So it's now available 7 days a week. Patients can follow that open scheduling process or schedule through MyChart. They're both available for virtual immediate care. Virtual immediate care is limited to certain reasons for visit. So things that are not acceptable, i.e. you've got a fracture or concern for a fracture, we can't really see you virtually. So those are not available for virtual immediate care. But depending on those few questions that they have to answer, they get routed to the appropriate choices, and then a patient can choose in-person versus virtual, and then schedule an appointment, just like I showed you on the previous page. Once they schedule it, they will get a notification in MyChart to be able to join that telemedicine visit. If they don't have a MyChart, our team will actually connect with them through the link that they receive to join the visit to get them activated on MyChart, as well as making sure that they can then complete all of the registration components. Virtual immediate care is available from 2 to 8 p.m., 2 to 8:30 p.m. Monday through Friday. And then for right now on the weekends, we're just limited to 2 hours in the morning. We'll continue to grow those hours as kind of need persists. But the whole goal here is to provide us a supplementary service for immediate care, and then for all of these patients to hopefully go back to their medical home and go back to their primary care provider for any follow-up that's necessary. So you may start to see some messages coming from our immediate care providers, letting you know that they saw the patient, and they may have recommended a follow-up within a week or two for the reason for visit that they received. We've also updated our appointment reminders. So this is more so for our Lurie patients, but what's important for, I think, this group is with this new version of appointment reminders, we've got a more functionality available. So patients can actually reschedule directly from the text message. So I was trying to actually get you guys a screenshot, but from the text message, they will receive a text message that says Y to confirm, N to cancel, or R to reschedule. If they reply R, they will see this window here to be able to pick another date and time within the next few weeks. And then from there, reschedule it all through text message and loading up into their browser. They don't need to log into MyChart or do anything else. And on the right-hand side, any patients who have multiple appointments, and I know we have a lot of complex patients, we're seeing here about 20-ish% of our appointments occur on the same day as another appointment at Lurie Children's. So all of those patients aren't bombarded with multiple different text messages. They can actually see a full itinerary of all of their appointments and make sure that they go to all of their appointments so that we can get you all those services and then hopefully a cohesive view back as to what's going on if they see multiple specialties. And then the last piece is MyChart expanded access. So a couple of items on expanded access. So one is proxy standard. So as I said at the beginning, all those specialties are available for online scheduling. Now any patients over 12 can actually sign up for limited access of a MyChart account without necessarily signing an authorization form. This gives the caregiver the ability to make appointments, message the care team, check some general demographic information, but they can't see any detailed health information. If they do need want to proceed with seeing more detailed information, they would still need to follow our standard process for enhanced MyChart proxy access. And so for the time being, those patients who do just need access to be able to schedule an appointment, get appointment reminders, etc., they can do that all through the website and just clicking on sign up for MyChart access right here. And then the last piece is we now have MyChart Spanish available as of July 6th. And so patients can actually on that homepage, just click on Ver en Español or where it says view in English now, if you want to flip back and forth. And then once they've logged in, there's a small little globe icon that they can click on to switch languages and it'll translate the whole experience. And anyone who has the app on their phone, as long as the settings on that phone are set to Spanish, they can use MyChart in Spanish. Sorry, I talked really fast in 7 minutes, but I can take any questions or dive deeper in any of the items that we just talked about.
No, this is great. I mean, it's exactly what we were hoping you'd be able to do for us. So if there are any questions, feel free to, again, raise your hand or type it in the question box. So what I'll ask right now is, well, bear with me as
I see
pull everything up. You see Dr. Waskow's question there?
Yeah, so for Shoshana's question, a question for everyone is, we've entered an urgent, if you've entered an urgent referral in Epic, will that impact a patient's ability to schedule into an urgent slot on MyChart? It will not. So if a patient does need an urgent referral, they can still call our centralized access center. They will still be able to schedule via MyChart and go through a decision tree. That urgency hopefully does come through as they're answering the right questions in the decision tree. However, if it doesn't, it may allow them to schedule further out than you would like. So if you still want to have them seen within a week or 2 weeks, let's say, I think it's very reasonable still to reach out to division to just make sure someone is actively calling that patient. Or so the urgent referrals are still worked by the centralized access center. So we will still reach out to the patient. They just may not be able to do it through MyChart. On the other hand, if a patient does try to schedule through MyChart and is able to schedule an appointment within the appropriate time frame, they're only shown that time frame that is appropriate for them to be seen based on the questions they answer during the decision tree. And then they should be able to then schedule an appointment as long as there's availability.
Great.
I hope that answers Dr. Waskow's question.
Okay. That is all the questions that we're seeing so far. I think that's all we have then for you, Dr. Patel. You know, we've been getting great feedback from the community about this. So I just, on behalf of our team, would like to thank you for just for all your hard work and putting this together over the last couple of years, because it's just been a great added feature and enhancement to for our patients here at Lurie Children's. And so I just wanted to thank you for that. But it looks like all the other questions are still coming in for Dr. Jhaveri's special ID questions. So I'll use those for later. So thank you for joining us, Dr. Patel. And if any questions come about throughout the session, I can either email them to you or feel free to stay on if you have time. Okay.
Sounds good.
Thank you so much.
Thanks, everyone.
Yeah. So as we continue on to our symposium, I'm going to send it over here to Julie Kalkbrenner. She's got some great information for you about some new outpatient centers and services that we have to offer.
Thanks, Chad. Hello, everybody. I first wanted to introduce our newest satellite site in Naperville. This is an orthopedic clinic really focused on fracture care. And we have hours 5 days a week. Our two orthopedic providers out there are Dr. Beakey and Dr. Lindell. They've been practicing in the community for many years and are now with Lurie. So we're delighted that they can stay in their Naperville area and continue to serve your patients out there. Appointments for these providers and our Naperville clinic can be made by calling 1-800-KIDS-DOC or through Lurie MyChart. And secondly, I'm happy to discuss our newest service offered out at Northwestern Medicine Huntley Hospital, and that is the coverage for our neonatology service out in the nursery at Huntley. So we have a team of 5 Lurie neonatologists who share the care on a 24/7 basis. Services for the level 2 nursery include attendance at high-risk births or by the request of an OB. We also care for infants in the level 2 intermediate care nursery, as mentioned, and we are also performing infant exams at the request of the hospital or the request of the dedicated pediatrician. So those are our 2 updates for those satellites. And then Paula has some other information to share about Silver Cross.
Yeah, and it looks like I'm having a little trouble with my video, but
I see you great, Paula. You're looking good.
Okay. So new at Silver Cross starting in August was their move to a level 3 NICU, and our neonatologists are staffing all 24 beds. They're available on site or on call 24/7 and attending high-risk deliveries. And this is the only level 3 NICU in Will County. So it's a significant improvement for the care there. Along with the neonatologist staffing the unit, there are other specialties being provided in the NICU and within the hospital: ped surgery, anesthesiology, cardiology, rehab, and then remote neurology and medical imaging. And then in the outpatient center, which is in Pavilion B, we are starting a NICU developmental follow-up clinic in the beginning of November. And that will be joining all the other specialties that are available on site at Silver Cross through Lurie.
You have some other exciting news for us, I see here, right, Paula?
Yes, we have a new partnership starting October 3rd at Franciscan Health Crown Point. Some of you may be familiar with the former name of St. Anthony's. And Franciscan Health Crown Point is in the process of building a new replacement hospital. I think they anticipate that opening up in 2024. In the meantime, Lurie will start staffing their level 3 NICU, which is 20 beds. And again, we'll have that on-site on-call delivery and attend high-risk deliveries when requested. Along with that, also starting October 3rd, is the NICU developmental follow-up clinic, which will be there on site. This clinic, the nurse practitioners will care for the future patients after October 3rd, and will also care for previous patients who have been in the NICU prior to Lurie staffing it. So very excited to be in Northwest Indiana with our Lurie neonatologists.
It's very exciting. We're able to start providing care into that region. So it's great for all parties. So thank you for that update, Paula.
Thank you.
And then I have a little update for you as well. So I know we have a big portion of our audience that has patients in the Arlington Heights area. And I just wanted to give you all just kind of a friendly reminder that we are no longer providing emergency department care, as well as neonatologists and hospitals care at that hospital. But we still are there in the Bussey Center, and we still provide all of our ancillary services that we have provided in the past. And we also encourage you to still use our neonatology hospitalists and pediatric ED services downtown or at Northwestern Medicine Central DuPage Hospital. So we are always going to be here for you and care for your patients in that area. So if anybody has questions regarding that, please type them up or we can discuss live after the symposium. So thank you for that. So next up, and we're getting to the conclusion of our symposium, we'd like to introduce to you some of our new specialists. So Paula, go ahead and take it away.
So we have in allergy and immunology, Abigail Lang. She'll be seeing patients at both locations in the city main hospital in Lincoln Park. Cardiology, Dr. Mira Kashari. She'll be seeing patients at the main hospital. In cardiology, Dr. Amanda Marma Parak. She's been at Lurie, but is now expanding her expertise in preventive cardiology and is doing a clinic in New Lenox in addition to the main hospital. In genetics, we have Dr. Peter Leahy seeing patients in Arlington Heights. And in GI, we're excited. We have two new providers, Dr. Amanda Gomez seeing patients in Arlington Heights and Lincoln Park, and Dr. Natalie Hoffman seeing patients at the main hospital, Lincoln Park, and in New Lenox. And we also have two new providers in neurology and epilepsy. Dr. Joanna Garcia Pierce seeing patients at the main hospital, and Dr. Divya Desai seeing patients at the main hospital too.
Yeah. Paul, why don't you stay? Oh, go ahead. Go ahead. I didn't mean to cut you off.
I was going to say, and Julie will tell you about the new surgeons that we have.
And Paul, why don't you stay unmuted and keep your camera on, as I have a few questions for you after that. Go ahead, Julie.
Sure. Okay, I'm happy to introduce the new surgeons that we have at Lurie Children's. Dr. Thomas Inge is our new surgeon in chief. He's actually been with Lurie for almost a year now, but we just wanted to put out our new reminder that he is our surgeon in chief. We're going to be changing of the guard here very soon. And he is still going to be focusing on the adolescent and bariatric surgery program. He's picked up the program that's out at Central DuPage and is looking to incorporate it downtown at Lurie Children's and have a little bit more of a multidisciplinary flair to it. Dr. Guillermo Ares is one of our other general surgeons, and he's going to be practicing full-time out at CDH. He's replacing Dr. Ann O'Connor, who left us earlier this year. Dr. Ares will also be working with the adolescent bariatric surgery program that's in existence out at CDH already. Within neurosurgery, we have Dr. Jeffrey Raskin. He has some really new groundbreaking therapies to help our patients with epilepsy, movement disorders, and pain, chronic pain. So he's a functional neurosurgeon. He has a functional neurosurgery clinic that really focuses on the movement disorders. And he also has a clinic out at Shirley Ryan as well. That's an inpatient clinic type program. He'll be using some progressive technologies for pain management, movement disorders, and epilepsy, such as deep brain stimulation and laser ablations. We have our three new orthopedic surgeons, Dr. Beakey, Dr. Ibrahim, and Dr. Lindell. We are delighted to have them with Lurie Children's. As I had mentioned before, all three of them actually have been practicing in the western suburbs for many years, and we are delighted to have them under the Lurie umbrella. Dr. Beakey is practicing out at Naperville, along with Dr. Lindell, and Dr. Ibrahim is seeing patients in New Lenox and Westchester. And lastly, within orthopedics, we have Dr. Brett Lulo. He will be seeing patients at a variety of locations, the city, Clark Deming, Lake Forest, and Westchester. And he's going to be focusing his clinic on spine issues along with general orthopedics.
Thanks, Julie. So Julie and Paula, my understanding is we also have some new endocrine people coming on, but we don't have all their information yet, but we will be sharing that with you all over the next few months once they come aboard. And is there any other updates, such as people that we need to know that have left due to retirement, that we should bring aware to anybody, or we're pretty good on that?
Well, I do think that we will be announcing that Dr. Marlita Reynolds will be leaving at the end of this year, Chad. She's been, our chief of surgery, had been for many years before Dr. Inge stepped in, and has been really seeing patients referred by many doctors over many years. So will be a big change.
It will be big change. Yeah. Okay. Well, thank you. And as I mentioned, any other specialists that come aboard, we'll be sure to announce them for you and get that to you as soon as possible. So now we invite you to stay with us to ask questions. Whether it's you want to have an open forum discussion live, or if you want to ask some questions in the chat room, you're welcome to do so. Before we do that, I'd like to encourage you all who are on social media to please follow us on Twitter, YouTube, Facebook, and LinkedIn, as we usually post some very vital information about Lurie Children's and about pediatric healthcare in general. So a lot of great information on there. And then in our YouTube channel, we always have our symposium and our roundtable discussions there for you. So I'm going to go ahead and stop sharing, and then we can go ahead and see if there's any questions or people who want to talk about anything. So what is the easiest way for us to find out these days who is interested in particular areas within a specialty? Paula, would you like to take that one from Dr. Waskow?
What was that question again? Sorry.
What is the easiest way for us to find out these days who is interested in a particular areas within a specialty?
So what their special interests may be.
Yeah.
So those are you can go into our website and go into our referral directory, and within that area, there's the quick reference guide, which lists all our specialized clinics and all, and which doctors had those up. And also in the referral directory, under each division, there are lists of all of our physicians and APNs and what their special interests are.
Mm-hmm. And then also you can refer to our physician services webpage, and what may be helpful is the list of specialties for each location from our schedules, and they'll tell you each physician, and if there's a physician that interests you, that is also on our Find a Doc page on our website. Or Dr. Waskow, please feel free to reach out to me, as I'm your liaison, and I'm happy to help you with that as well. And then Julie, here's a good one for you. Can we get more info on the new orthodox in Naperville? Maybe panel cards or practice interest. I have a peds practice in the same building with them, and I'd be happy to meet them. That was from Linda Steve.
Sure. Yes, we are starting to promote those services with our orthopedic providers out in the Naperville area. So I know which practice you're with, Linda, and I'll be able to get some information to you soon, probably sometime in early October. I would like to also add, regarding the last question from Dr. Waskow, this is more of a patient-facing way to find out which specialists are available on which days, but you can also, when making an appointment through Lurie MyChart, it does ask for what the condition is that you're looking for the appointment for, and it is able to provide a variety of specialists for you, but that's more of a patient-focused way to find out as well.
That was an excellent point, Julie. Thank you for doing that.
Thank you for your question, Linda.
Well, I don't see anything else out there. So, we just want to thank you for joining us. This was a big group today. A lot of you joined us, and we're just super excited to have you as partners. And please remember that Paula, Julie, and I, we are your liaison. So if you have questions regarding Lurie Children's or any other issues, please reach out to us, or we'd be happy to come to the offices again. We would love to come in and have a meeting, talk and catch up and see if there's anything you'd like to talk about, or if there's anything we're doing that we need to improve on, or if there is stuff that that you're seeing that we're doing well. We would like to hear both of that for you. Again, we're your partners, and we'd like to help you out. So And then,
Chad, I want to add one more thing.
yes,
If
go ahead,
you
Paul.
have a topic you would like us to cover on the next Community Provider Symposium, please let your liaison know. We want these
Absolutely.
meetings to be for you.
Mhm. Thank you for that, Paula. And then be on the lookout for a few of our roundtable symposiums coming up, or not symposium, but our roundtable discussions. We have a GI one coming up in adolescent medicine, cardiology, and a HEMOC one for you this year. We're very excited to bring those to you. So be on the lookout for your invitation of those. But if there isn't anything else, thank you very much for joining us today, and have a great afternoon. Be well, everybody.